Going into our health segment, we're talking about complications of untreated diabetes. But before then, let me read a few of your messages.
Oh, Chale, no, Kapasta, you there for?
And
we introduce our guest, right?
Yeah,
after your messages. Please hurry up.
A few of them. We asked you to send us whether the reason why you would or would not vote in the upcoming elections. Gabriel Agbeduni says, I will vote because this administration has made us struggle too much. Another one says, I'm not voting because politicians are making my people kill each other. So he means Boko and other places. Another one, good morning, Channel One. I'm Zakiu from Northeast Region. I'll definitely vote from December 7 because I wouldn't like a dead goat to lead me as president in this country anymore. Richmond from Tema West says, I'm voting for NPP this year because, if anything, I am a beneficiary of free senior high school. And we'll read more of your messages. Keep them coming.
The messages are very dangerous.
Keep them coming to the WhatsApp number 0204-447-033.
Community focus segment
447-033, and we will read all those messages. Right now, we're going to talk about untreated complications of untreated diabetes, and our usual suspect is joining us, Dr. Adams, Dr. Kalsum Zakaria Adams.
The lady in red.
The lady in red.
Look, you're welcome.
Thank you. Thank you. It's always nice to be here with you, as usual.
On Sundays. Yay.
It's always a pleasure having you, actually. I mean, a lot of our viewers like the education you give and the insights you add to the education.
That's nice. At least we are reaching out.
You know, initially, they used to say you scare them, right, with all of the don'ts. But I think they are picking up. They are getting the sense in.
Okay.
The warnings. So, untreated complications of diabetes.
Complications of untreated diabetes. Today you're just mixing numbers up. You're hungry. We are very fine.
Some
fufu or some mutio after the show.
Very important.
Let's recap a bit of what we've learned so far on diabetes, and then we can go into the complications.
Okay. All right. So for the past weeks, we've been speaking extensively about what diabetes is, and diabetes being, in layman's terms, having high sugar levels within your blood, and the reasons being that is either you have a defect in the action or secretion of a hormone that helps in the redistribution of sugar within the blood into the cells where they are utilized. So either that or a combination of the two. And once you have hyperglycemia, which is diabetes with all that I have mentioned, you end up having some signs and symptoms associated. And we went on to talk about some of these things that you may present with. Some people may not even know that they have diabetes until they end up with a complication, which we'll delve into today. And others too may not have any signs and symptoms, will be walking around until they end up with a coma, or they end up with a stroke, or they are brought to the emergency, and then you check and then you realize that the underlying problem is actually diabetes. And then others too may have the classical signs and symptoms of diabetes, which we mentioned the last time, which are you having polyuria, polydipsia, polyphagia. So polyuria is you making large volumes of urine at a time. And then polydipsia, you having to drink a lot of water at any point in time because of the underlying condition. And then polyphagia, you having to eat large quantities. All of these may be some indications for you to know that there's something sinister happening and you need to have a look at it. And then there are others too who come with some complications, like you having kidney problems, having eye problems, and then some people even end up coming with strokes. Okay. and all of these. So it's a whole spectrum. You may end up not having any signs and symptoms, and then you just go in and then you are diagnosed, or you may have some classical signs and symptoms which you have mentioned, and then the ones that come in the extremes. And we went on to talk about some of the tests that you can do, some of the investigations, the most sensitive ones, and the ones that you can just do with you having to do a fasting blood sugar, which is not too sensitive, but at least it gives you an idea. So you do a fasting blood sugar, and ideally anything below 5.6 should be fine, okay? But if you have 5.6 to about 6.9, we said that that's impaired fasting glucose or pre-diabetic. It means that at that state, you have one of your leg in diabetes and then you have the other in normal. So if you do not take care of your habits, it means that you're likely to go or to become full-blown diabetic. And then we went on to talk about the random blood sugar as well. So random blood sugar is also useful where you can come in possibly in an emergency situation where you may have eaten already. So we can check, and then there are values as well. If you have 11 and below, should be okay. But then if you have 11.1 with symptoms, it's an indication, or it gives us a high risk of suspicion that it's likely you're diabetic. And we spoke about the glycated hemoglobin, where that is the most sensitive in diagnosing diabetes, because it gives you an idea of the glycemic control over 3 months. So you're able to tell, and I even give a joke about people who are diabetic and then they go home because of all the restrictions in the diet. They tend to cheat themselves, so they end up doing all they know that their appointment exactly. Then they start doing all the right things, and then they come.
It's interesting because last week when we discussed diabetes, it was the 3rd week straight we had done that, and I was thinking we had probably exhausted all there is to talk about diabetes.
Exactly.
Only for you to come up with a different angle to it, looking at the complications associated. So what exactly are you referring to, and why is it important to pay attention to it?
Yeah, so it's very important because when I defined diabetes, I mentioned that you have high blood sugar levels, and then probably due to a defect in the hormone that would help with the redistribution. And it also involves multiple organs and then multiple substances. So multiple organs means that it affects every part of your body. You get it? And for a human being, from the basic units, you have a cell, and this cell, when you have a number of them coming together, you have a tissue formed, and these tissues, a number of them would give you an organ, and then eventually different organs would then come together to give you your whole system. So this is a disease that affects the cellular level, and it affects different organs. Okay, so the organs that we would want to talk about would be from your retina, so your eye. It has some complications related to the eye. It has some complications related to your kidneys. It has some complications related to your brain, and then even your nerves, very important. And then eventually you can end up having some chronic ulcers that cannot be treated, and you may end up having to lose that limb. Okay, so how does it happen? Usually when you have this high glucose levels within the blood, we have something we call plasma protein. So within your blood you have the liquid parts, and then you have the cellular parts. So the liquid parts, which we call the plasma, we have some proteins that are in there that helps to transport certain substances in and out of your organs, and then eventually you end up having an organized system. But in cases where you have high levels of sugar, which is the hyperglycemia within the blood, when it stays there, it doesn't only stay there, it tends to form something we call aggregated glycation end products. So these AGEs, so for short, AGEs. So these AGEs, when they end up, once they are within the blood, what they do is that they end up getting deposited in various organs, the basement membranes of various organs, and that's where the trouble starts. So if you have these agents being deposited at the basement membranes of your eyes or your retina, specifically the retina of your eye, what happens is that you end up having some eye symptoms related to the complication of untreated or poorly controlled diabetes. So you may end up having blurred vision. Some actually, you may not have any symptoms at all until you end up with the extreme, which will be blindness. Okay, but then we call it diabetic retinopathy. So it tends to affect the function of your retina. So you may end up with blurred vision, that's one, or you may end up with other signs and symptoms all the way to blindness. So you not being able to distinguish color, so color vision defects. Okay, then if nothing is done about it, eventually it moves on until you may end up being blind. So that is what we call diabetic retinopathy associated with uncontrolled diabetes.
Will you say a compromised immune system is a possible complication of suffering from diabetes?
Yes, definitely. I mean, once so you see, the whole definition when we started, we said it affects different organs, and it affects and it involves different substances. So the different organs, it actually would affect your white blood cells. So your white blood cells will now become much more sluggish. Your white blood cells are the cells within the body that will help you fight infection, that will help you mop up if there is anything, a dead substance in there. Okay, that will help you maintain your immunity, will help you fight against anything that comes inside you. You would be able to take care of it. But then in a diabetic state, it tends to affect your immunity. Okay, so that's also, eventually we'll talk about it, where it will affect if you should have a cut or if you should have a sore or an ulcer. It becomes difficult. Exactly.
Do you have the numbers
very difficult
on COVID, for example, where COVID exposed a lot of things, right? From economies to like world trade to supply chain and even health. Right. So do you have the numbers on how people who were suffering from diabetes or were treating diabetes were exposed to the virus and the aftermath?
I'm sure there are, but then it will put them at a risk where they become, because they already do have a reduced immunity, they would end up having all the morbidities associated with some of these COVID. In fact, even simple infections. You don't even have to go to COVID. Even simple infections. Let's say you end up getting a cut somewhere. Because of the reduced immunity, you have the risk of either losing that part of the body, if it is your extremities, or it becomes a chronic ulcer. Some people come and then they don't want to.
And it's a lifetime. So for example, is your immunity to some of these infections
No, so
a
it
lifetime
has to be controlled.
Wow.
So once the diabetes, you've been diagnosed diabetic, it needs to be controlled. So how do you control it? You control it by giving medications. So you are given some medications, so either the oral hypoglycemic agents, or you are put on some insulin replacement, depending on the type of diabetes that you have. Or there are times that you can have a combination of any of these. So once you are put on these treatment regimen, then you need to continually check, because it will help reduce. It's a titration. You would have to titrate until you get to a level where the blood sugar levels are controlled.
Okay.
So once the blood sugar levels are controlled, it means that the hyperglycemia will not be there anymore, and then all the complications related to it, you wouldn't have them. So you can control it. Okay, management, you can't cure it, but you can control it. once you control it, and then also with your diet.
So once you get diabetes, you have it for life.
You have it for life. And most of the time, you see people, you can control it to the extent that even now your sugar levels will read normal. So that is where the danger is. So people will then now decide not to continually check, continually be on their medications, and then they start dipping again. So before they realize it, maybe they are down with one complication or the other. You get it? So you need to control. There are times that you can even control it to the extent that some of the medications can be withdrawn, and then you just be on diet modification. You get it? But people, you know, you always would have to say this with caution so that they are continually monitored over the period, so that you don't end up going into hyperglycemia again and then getting the other complications associated with it. So we're talking about the complications, and we spoke about the diabetic retinopathy. The other thing is that it can affect your nerves. So your nerves are usually, they usually go with your blood vessels, where it helps you with you being able to perceive touch, pain, and temperature. You know, you being able to perceive position sense. You're able to tell that, okay, my limb is here, or my limb is...
I think you mentioned it last week.
Exactly. You get it. So if these ages also gets deposited on the basement membranes of these nerves, and then we have different categories of your nerves. We have the ones that control your motor. Motor is action. So I'm able to move my body, you get it. And then the ones that do control sensation is also there. You remember? Okay, good. And then the ones that do control something we call an autonomic nervous system. Okay, so that is what will help you sweat. That is what will help you. It's an automatic system within your body that helps you. You know, so all of them, each of them would give you some side effects or some complications, in the sense that if you do have an autonomic effect of the diabetes, it means that your skin is going to be very dry, because it helps you, I mean, with sweat and all of that.
So
but
dry
your
skin is
going to, yes, so it's going to give you a very dry skin, and this dry skin can easily crack. And if it easily cracks, what happens? You have microorganisms going in, and then the whole cycle starts. You know, so you may end up with an infection that you are unable to tell.
Doc.
Then the weakness as well.
You know, maybe you come back to the weakness, because maybe this question is also linked to it. But very briefly, I hear people say an unspoken part of dealing with diabetes and treating diabetes is the mental health it has on the person. You know, they say this is for some, it's actually the mental health complications that takes them to the grave. Maybe in dealing with a weakness, you can just segue mental health concerns around
it as well. Okay, so yes, so then if it affects the motor parts, then you end up with the weakness, and you have something we call lethargy, and then you end up you're unable to do the things you're supposed to be doing. Okay, and then if you do have it affecting the sensory part of it, then you are unable to even tell the position. Let's say if it's affecting your lower limbs or your upper limbs, whichever, you're unable to tell exactly the position, or your sensation now becomes reduced. So all of these will come together, and then if you should have any cut or an infection or a breach in the barrier, which is the skin, it means that it is likely that it is going to continually to grow. Okay, it will propagate to the extent that by the time you notice it, you have a very huge ulcer, and that ulcer is not healing. It becomes a chronic ulcer. It's not healing. And why is it not healing? Because of the fact that your immunity is low from the diabetes. Blood doesn't get to the area, and even if it does get to the area, because of the sluggish nature of your white blood cells, you're unable to cater for the infection that is causing this particular chronic ulcer. So eventually you would have to go through certain investigations, and these investigations will help know the blood flow to the area, and then if it has to be treated surgically, it will be treated surgically. where it depends on the blood flow to the area. You may end up having certain surgical procedures done to the lower extremities. Then the other complication that we can talk about is the effect on the kidneys. So affecting these agents can also go to the basement membranes that affects that is within the nephrons, which is the basic cell of the kidneys, and then end up giving you kidney problems. So the kidney problems, you may end up with kidney failure. So now the kidney is unable to filter the blood the way it's supposed to. So you end up with all the toxins in there being retained, or you end up having something we call proteinuria. So proteinuria, where your proteins, which are not supposed to be filtered through the kidneys, are now filtered, and then you may end up having uncontrolled, persistent hypertension. So I always say that diabetes and hypertension, most of them, they go together. Exactly, one can cause the other. And then you mentioned the
mental health.
The mental health as well. So the mental health specifically, it affects the extremes of the complications. So from a very mild state of you being told that you are diabetic and you have to be on so and so and so and so, you have to restrict the kinds of foods that you take, and then all of that. Yes, some people do not want to be on medications for life. So most of the time, when you are treating some of these, it's multidisciplinary, where you have a psychologist on board to talk to this patient and then let them understand. Now, the one I would want to stress on has to do with you having a chronic ulcer, maybe on your foot, and then now, from all the investigations, the only option that will be available will be to do the amputation.
Wow. I know.
You get it. This is where you really would need the psychologist to come on board to speak to these patients, because some end up being in denial. I remember there are a few that when we saw on the surgical ward, and then they come in, you tell them, okay, so we've checked, we've done our Dopplers, we've done everything, and we think that you have peripheral artery disease and this limb needs to go. Otherwise, it becomes a focus of infection, and then it affects all other parts of your body. Now, the first thing is either they burst crying, so you know that, I mean, now they feel that their world is crumpled. The second thing is that they come back and they tell you that, no, because I don't want to end up becoming a burden on my family members and all of that, I would rather go home with the foot than to go without the foot.
Wow.
So some actually would ask you to discharge them, and then they go home.
But is it
home,
medically allowed? Can you?
Yes, so you would have to sign.
You sign.
You sign
so
against medical, exactly, against medical advice. So you sign that, they go home, but then they come back. Some people after 2 years, they come back 2-3 days after or a week after, and it's worse. And now they consent to the fact that because they will be in excruciating pain, and then it's a chronic ulcer, so there will be some smell, all of that, you know, associated with it. Then eventually they get to accept it, but you need to counsel them. Very, very important. You really do need to counsel them.
We should continue this next week.
We'll continue this conversation.
We'll start from the point about how people opt to go home with their condition not significant.
Well,
but I'm so grateful for your time.
Thank you so much for your time.
Thank you too.